Greetings from the American Council of Academic Physical Therapy and greetings from the Medical University of South Carolina. Thank you for the opportunity to share the key components of Caregivers Are Heroes, an innovative, interprofessional, experiential learning strategy that's community-based and caregiver-focused. Caregivers Are Heroes is designed to enhance caring and compassionate attitudes in first-year OT, PT, and PA students. For the past 5 years, we've had 180 students each year engage in learning about the caregiver perspective. A caregiver is an individual who provides unpaid care and support for a family member, friend, or partner with a disability who needs assistance with activities of daily living. Research has shown that caregivers may experience poor health, social isolation, discrimination at work, stress, and physical injury. Each year in the US alone, 29% of our population, or greater than 65 million people, provide care for a family member or friend or partner who has a chronic illness or disability. So how do you add humanism to your academic context? Well, you do it very thoughtfully and with great preparation and with a lot of support from community partners, both locally, nationally, and around the world. The design and initial implementation of this learning activity was originally supported in part through funding from the Arthur Vining Davis Foundations. But now this learning activity has been successfully embedded, so it's now sustained because it's a required curricular component of all 3 professional educational programs. I'm going to talk about the other partners as I go on to the rest of this presentation. Now that it's been successfully embedded in all our courses, complete with learning objectives, the planning of this activity involved looking across all the curricular schedules, identifying the barriers, and identifying a common time where all 3 groups of students could meet regularly over the course of a semester. So we carved out 2 hours late in the afternoon, 1 day a week throughout the summer semester, which is when we begin our programs each year. Although we didn't use all the 2-hour blocks of time over this semester, it created freedom of flexibility and scheduling for the students to meet and discuss their projects that were required as a part of this course. But we did have didactic preparation prior to the caregiver interview, which is the highlight of this learning activity. We had 3 2-hour training sessions prior to their in-home caregiver interview sessions. The first session, we introduced our community partners to the students, and they came, spoke directly to the students, and gave an overview of their organization, as well as the needs of the clients that they served. The Trident Area Agency on Aging provides respite care, resources, supplies for individuals who are caring for adults with disability. Patterson's Academy is a special school in the Charleston, South Carolina area for children with multiple disabilities, cognitive, physical, etc. So the caregivers involved there were the parents of these children. The caregivers for Trident Area, the Agency on Aging, in the Trident area is the 3 counties surrounding that Medical University of South Carolina. Those caregivers could be children of adults with dementia. They could be adults caring for spouses with disabilities. So it ranged the whole gamut of age for the caregivers. That was session 1. They also identified resources that they hoped the students would share with the caregivers during their session if the need arises. This would be like fall prevention, home safety handouts, patient education information. Very generic and applicable throughout all professions. Session 2, we invited several campus speakers that represented colleges of medicine, colleges of nursing, and the College of Health Professions to come and speak. Our humanities scholar in residence, Dr. Herman Blake, spoke on empathy and the value of listening. Two of the individuals who spoke were caregivers themselves at one point in their professional careers and spoke on the reflections of caregivers, some of which are published and available for the students to read. And we had a professor from the College of Nursing who works in palliative care as well to discuss empathetic communication. The third session involved Dr. Lisa Carr from our Center for Academic Excellence, which is also the Writing Center at the Medical University of South Carolina. But this activity that she spoke to them about did not involve just writing. She spoke to them about using the humanities and narrative healthcare to present their reflections on their caregiver interview experience. We canceled all PowerPoint presentations after the first year because it was death by PowerPoint with 180 students. And we collaborated with our Center for Academic Excellence to discuss narrative healthcare. The students were given grading rubrics that show how they could use art, poetry, music, drama, storytelling to present reflections on their experience. And we believe that the emotional context with this learning activity is what had the greatest impact. Finally, after the 3 training sessions were completed, the students were actually divided into interprofessional teams of 3 to 4 students. So out of 180 students, we had over 54 teams of groups of students, and each were assigned a caregiver to complete an interview session with. So these 2-hour blocks of time allowed them to meet with their caregivers and do their reflections. And I see that I'm out of time, so I'll quickly just go to some of our initial results. That this is the Jefferson Scale of Empathy, and if you look, when they first entered the program and when they graduated, we did not beat it out of them, but we're in the process of looking at these scores to measure their meaning and to continue forward on evaluating the effectiveness of exposing students to the caregiver interview. The Medical University of South Carolina, which is has in its strategic plan, in addition to globalization, it has interprofessional education and collaborative practice, was also the impetus for designing some of these activities. And as you can see, we have numerous interprofessional campus-wide activities at the Medical University. The students rated this activity as perhaps the one of greatest educational value during their 2 to 3 years while on campus. And their anecdotal responses from the caregivers themselves as well as from the students indicate that the students feel like oftentimes having a relationship is just as important or more important than the care that you provide. So with that, I will close, and I look forward to any questions that you may email me to follow up, but the article and the reference gives an overview of our Compassionate Professionals program at the Medical University. Thank you very much.